country. So with that, we shall move on to Stanford. Is Stanford on the line?
Yeah, we're here. We're ready to go.
Cool. Take it away.
All right. Thanks, Brandon. All right. Can you guys see okay?
Yeah, I can see it.
Looks good.
Okay, well, thanks again to PM&R Scholars for having us. I'm Nolan. I'm a PGY3 at the Stanford University PM&R program. And my goal here is to just give you guys a sense of what our program is like and kind of a showcase in just 20 short minutes. And at the end, if you have any questions, feel free to type them in the chat. I've got some colleagues on the chat as well, so they can answer the questions during the presentation if needed. But we'll get started. We'll dive right into it. So first of all, I just want to showcase some of the core rotations and the rotation sites that we do. We have some rotations at Stanford Healthcare proper, Stanford Healthcare affiliates. We're also down at Valley Medical Center in San Jose, and we're at the VA as well here in Palo Alto. And so, just being a little bit more specific in those rotation sites. Stanford Hospital proper just moved into a brand new facility, state-of-the-art. The rotation itself offers some pretty unique cases and some rare pathology and kind of a diverse patient population. Moving on to the Stanford Clinic. So not quite in Palo Alto, but up the street in Redwood City is where the Stanford clinics are located. And so we spend our sports and spine time here. The rotation itself offers some pretty unique experiences, some cutting edge procedures, and some pretty rare pathology that gets referred. So overall, it's a great learning experience. Another key rotation site is the community hospital down in San Jose, Santa Clara Valley Medical Center. It's a level 1 trauma center and the site where we do a significant portion of our inpatient rehab and our neuro rehab rotations. And so Santa Clara Valley Medical Center is one of the high quality performing acute rehabilitation centers in California and on the West Coast. And it has a very large catchment area. So we see patients from Oregon, Hawaii, Nevada, everything from TBI to spinal cord injury. And because it is a community hospital, it does give us some exposure and allow us to treat patients of different socioeconomic backgrounds. Anything from the Medi-Cal population to VIPs. And just touching on some of the state-of-the-art facilities, we moved into the Sobrato Pavilion within the last few years, and it's been nothing but pleasant for both the staff and the patients. Okay, and our last key rotation site is the VA, the Palo Alto VA. And so we have a lot of our acute spinal cord injuries, chronic spinal cord injury, outpatient MSK. We do some EMGs. The Palo Alto VA is unique in that it actually is one of the few polytrauma acute rehabilitation centers in the country. And so we care for patients that come from all over the world who are stationed and had injuries. And the exposure to the veteran treatment population is helpful in our training experience as well. And so this is a map of where our rotation sites are located. And so I hope you can see my cursor. Valley is down here in San Jose. We have the Palo Alto VA in Palo Alto, Stanford Hospital proper, and Redwood City, where the clinics are located. So you can imagine in the Bay Area, sometimes the commute can be a little long. However, when we try to live in areas that make the commute more ideal. And so this next slide is areas where people typically live. Right now, probably the majority of people live kind of in the Mountain View, Sunnyvale area. However, some live in Palo Alto, Redwood City, as far as San Mateo, and occasionally someone moves up to San Francisco as well, typically later in the years of the residency program. So this is a sample resident schedule. We have the majority of our PGY2 year as an inpatient experience. And so we deal with traumatic brain injury, spinal cord injury, and polytrauma, both at the VA and at Santa Clara Valley Medical Center. We also have some spine from the Stanford Outpatient Clinic in the first year as well, second year, I should say. And then we typically tend to have more outpatient rotations later in our training. And some rotation sites that I didn't highlight, I'm circling PEDS here. We do have a PEDS rotation that's scattered throughout the Bay, at Stanford, at Valley, and as well as the Children's Hospital of Oakland. And then we do have a private acute rehabilitation experience at St. Mary's, which is an acute rehabilitation hospital and unit in southern San Francisco. So call, we take home call. We typically are on call about a weekend per month, and usually about a weekday per week. And then seniority, we actually take less call. Generally, there are two call pools. One is for Valley, and the other is for the VA and Stanford Hospital System. And I purposely put a image here of the secure chat that was recently incorporated into Epic at Valley. We use it for call on the unit. It's made things so much more convenient. Nurses can just text us with pages, and it's a lot easier for us to communicate with them. And it's made sign off a lot less tedious and safe. So kind of dwelling into the people, the bosses, Dr. Smook is our PM&R department chair. He is also an interventional spine pain-trained physician. He's heavily involved in research, both interventional spine research, and he actually is heavily involved in the wearable health lab, where they look at biomechanics and wearable health and its associations with MSK pathology. He's also the Spine Interventional Society president, newly elected. And then transitioning to Dr. Levin, our program director. He is also the director of the Interventional Spine Fellowship. Heavily involved in research as well, particularly in interventional spine. And we work with him very closely on our spine rotation with spine clinic and EMGs. And so I'll continue to kind of highlight some details of some of the attendings that we work with. This is just a few of the sports attendings we work with. Dr. Rowe runs a sports clinic. He was the Winter Olympics physician. He's been a consultant for some of the pro teams in the Bay Area. Something unique to our program is exposure to the performing arts medicine. Dr. Stanek has a clinic where he deals with people within performing arts. Dr. Cross does a lot of pediatric sports, and then Dr. Fredrickson, who's also the sports medicine director, the PM&R sports medicine director. We get a lot of exposure with him in our sports rotation, and he's heavily involved in research and always has projects available to help out with as well. Continuing on with some showcases, Dr. Oda, he runs the Spinal Cord Fellowship. He's the director. Dr. Terioka, the chief of the VA rehab, he has a unique acupuncture clinic that we help out in. And then Dr. Karanikar, he's just a phenomenal clinical educator and a crowd favorite for didactics, and great to work with. And then lastly, showcasing the Valley, some specific Valley attendings. Dr. Crew, he's the chair of the department. We work with him very closely, both on consultations, EMG rotations, spinal cord injury. He's triple board certified. Dr. Henry Hoy, he's the chief of brain injury, actually a Stanford residency alum and former chief resident. He's great to work with. Dr. Varma, our site director. And then Valley actually has a very unique respiratory rehab unit. So they have brain injury, spinal cord injury, and then as well as respiratory rehab. And we co-manage patients with Dr. McKenna. And this respiratory rehab is for higher level patients who typically require ventilation. And so Dr. McKenna manages the critical care piece, and we consult and co-manage. And interestingly, he's been on some groundbreaking research with stem cells for spinal cord injury as part of the SRIS trial that came out. This is a picture of our current program and our past program. We've got pre-COVID and post-COVID, or COVID times, I should say. Diving into research, there are a lot of opportunities for research. This is just a list of some opportunities that are currently available. The research opportunities scale everything from platelet-rich plasma research to interventional spine research to spinal cord injury, randomized controlled trials. So there are many opportunities, and there's always a mentor who's willing to help or willing to let you actively participate in the research projects themselves. So some extracurricular opportunities. A fun one that we've really enjoyed is our ability, or the opportunity for us to teach ultrasound to medical students. And so the Stanford Emergency Medicine Department runs an UltraFest. And so we run the MSK portion. This was obviously pre-COVID. There is an opportunity for the free MSK clinic that we run with Stanford medical students. And it's an opportunity for us to give back, and as well as teach medical students physical exam maneuvers, and it's an opportunity to showcase what PM&R is. And then we do have some unique sports coverage opportunities because the sports or non-op sports medicine fellowship is PM&R. We have some great opportunities to tag along and to experience sports coverage. There's a specific component, or I should say opportunity, called Biodesign Innovation, which is a class that we have the opportunity to take if we want. It's offered through the university, and it's appropriate being in the Bay Area. But essentially, it's an opportunity for you to collaborate with some business students and some engineer students, and you're assigned a medical problem, and you try to develop a solution. And so this is actually a project that one of our residents worked on to try to screen for DVTs in the acute rehab population, as opposed to traditional Doppler ultrasound. And so they had developed a apparatus that used bioimpedance to assess blood flow. What is our elective time? We actually have 4 weeks of elective time with the opportunity to have more with improving SAE scores. The electives have ranged from pain medicine to palliative care. Musculoskeletal radiology is a popular one. In the past, we've had some international electives as well. Currently not offering those in the setting of COVID, but some popular rotations have been with the Bodar Clinic in Napa Valley. He does some very state-of-the-art minimally invasive procedures, as well as the Regenix entity in Colorado. So where do our graduates end up? Pretty much all throughout the states, and working in different subsets of PM&R. Some do general, some do interventional spine. In the past years, we've had people go into palliative care, and so we really hit all aspects of PM&R. This past year was actually a fellowship heavy year. We had the majority of people opt to more training in a fellowship. Lots of sports, interventional spine. We had a pain medicine as well. And so kind of dwelling into the numbers, we understand that the Bay Area is expensive. And so this information can be found on the GME website. But things are a little pricey in the Bay Area, but the general consensus from our program is that Stanford compensates very well, especially compared to other programs in the surrounding area. And so in addition to the salary, we have the educational funds, we have housing stipends as well. And then they also pay for our California board license, DEA license. And so there are little, and we get a raise for conducting a quality improvement project. So ways that they help us live a little bit more comfortably in a place that's more expensive.
I'll give you a 5-minute warning, okay?
Thank you. So we'll talk about the Bay. Truly caters to all different people. We've got city life, we've got the beach, we've got nature. So you really can find your niche here, whether it be going out to eat in San Francisco or hanging out in Berkeley. We have the beach nearby. My door to beach time is like 35 minutes without traffic. If you want to go skiing, if you want to go hiking, Lake Tahoe is very near as well. And of course, wine country, Sonoma, Napa Valley, all great local areas for you to spend time. And it's PM&R. We have lots of time to spend. So with that, here's some points of contact. This is a photo of us from our recent retreat day. We went to Half Moon Bay, had a great time on the beach, got competitive in spike ball, had a blast. Before I open up to questions, we did want to offer some advice for virtual interviews. One of our residents actually just had virtual interviews for interventional spine fellowships. And so, just make sure your internet connection is prime. Make sure you have the optimized lighting, similar to that influencer status on Instagram. Make sure you're appropriate, have the appropriate setting, the appropriate attire. And then probably the most important part, obtain the coordinator's contact information. Like, problems are going to happen. This is such uncharted water right now. Just expect that there's going to be some speed bumps, and just be transparent and have a point of contact for you to reach out to. I think in this past interview session, an interviewer missed an entire block of interviews because some link wasn't sent out. So it happens. It's probably going to happen. So just stay calm, and then just be very transparent with the program to try to make it work. So with that, I'll leave the points of contact up, and I'll open up for some questions.
Just going to give you guys a 2-minute warning too, okay?
Okay, I've seen lots of thank yous. What is the structure of our formal didactic curriculum? So we have protected time every Wednesday morning from 8 to 1 p.m. actually. They give us a lunch hour. And we do didactics in blocks. They typically, it's on a 12-month scale, and so we block it off into sports and MSK. Spinal cord injury, traumatic brain injury, kind of the new, we have amputation and gait. And so it's all kind of sectioned off in different block schedules. Okay, thank you. Is there a strong mentorship program at Stanford? Yes. So when you begin your training, you are assigned both a resident mentor and a attending mentor. And so you sit down with them, you get to talk about, what your expectations are, what your goals are, and they do their best to help you meet their needs. If there's some discrepancy and, hey, you're probably better off with someone who's a little bit more familiar with that type of the field, then sure enough, we do get referred to someone who's a little bit more appropriate. But yeah, we do have mentorship. We are master, senior, resident, faculty. Okay, I got my colleagues. Perfect. What opportunities for research do you offer? So research is a huge component of Stanford, and there are so many opportunities. We have interventional spine opportunities through either Dr. Smook, Dr. Levin, sports medicine opportunities. Dr. Fredrickson always has projects available. Spinal cord injury, Dr. Shem down at Santa Clara Valley Medical Center has a model spinal cord injury system with a ton of data, and she's always looking for help on new projects. And so there's a plethora of opportunities for research. Work-life balance at Stanford is great. The weekends are phenomenal. Oftentimes people go hiking, oftentimes people go to the beach. When the city was a little bit more alive, San Francisco was fun, but the work-life balance is definitely a component of our program, and we like to balance it.
How about one more question?
One more question. Thanks for the help, Brandon. Community volunteer reach opportunities. Yeah. So the biggest formal component that we offer is through the Arbor free MSK clinic that's helped organize with the Stanford medical students. There are obviously opportunities for you to go out and take the initiative for yourself. However, the three that I mentioned earlier are the biggest components that we consistently volunteer with.
All right. Thank you guys so much. Another excellent presentation. Again, you put your contact information in the slideshow, correct, right? So any of you guys who have more questions for Stanford, please, send whatever questions their way. I'm sure they'll be happy to answer them.